Welcome to this episode. Today we're going to get into a big topic, namely the dysfunctional diagnostics affecting the musculoskeletal system. As you can imagine, this is a very complex subject, but we want to make it simple and, above all, easy to understand, since everything we say, do, or see in the various chapters and episodes included in this subject must have a practical basis. The objective biomechanical dysfunctional examination of the patient is composed of several steps. It is a therapist's priority to understand, through the history and the early stages of patient's observation, where to focus and which steps of the objective examination to choose, while leaving out everything else. One of the easiest and most immediate problems to diagnose concerns all those specific dysfunctional conditions which tend to concentrate in a specific area of the body, thus creating a dysfunctional pattern that we can see regularly and constantly in our patients. We then divided these recurrent patterns into 4 specific areas, referred to as dysfunctional biomechanical units. We now look at these areas, which we described earlier on our model. As we see, we notice these 4 areas. The first area of first unit that we're going to talk about is related to Unit 1. The starting point of Unit 1 is the top of the skull, hence the vertex, while the ending point of Unit 1 is the D4 vertebra. Right after that, we have our Area 2 or Unit 2. The starting point of Unit 2 is the C7 vertebra. The ending point of Unit 2 is the T8 vertebra. Next, we move to Area 3 or Unit 3, where the starting point is the T8 vertebra and the ending point is the L3 vertebra. Finally, the last area is Unit 4, a unit which starts with L3 vertebra and goes all the way to the end of the foot, obviously including the entire pelvic and the lower limbs. Starting from Unit 1, we can see that it includes the entire cranial sphere. Thus, it includes both cranial dysfunctions and visual dysfunctions, gnatological or masticatory dysfunctions. It includes the cervical region and the entire arm region up to the hand.